stroke can be defined as a brain attack due to your not taking care of your blood flow system, that is the arteries, or you could say the vascular system. The inner lining of blood vessels is very smooth in young adults, and endeavoring to maintain that situation is our discussion to prevent stroke. The cells lining the inner side of the blood vessels are called endothelial cells, forming one layer like a single cell layer carpet on the inner aspect of each vessel. With age, certain inevitable changes do occur in these arteries, that is, they tend to get thickened and narrowed. If steps are taken to keep your blood vessels clean without damage to the inner lining, a stroke or even a heart attack is only a remote possibility. So, the first step you should know is that stroke is preventable. Stroke happens when the blood flow to an area in the brain is cut off. The brain cells deprived of the oxygen and the glucose needed to survive die. If a stroke is not caught early, permanent brain damage or death can result. Let's talk about ischemic stroke. This is very similar to a heart attack, except it occurs in the blood vessels of the brain, or the blood vessels that bring blood to the brain. This is the commonest form of stroke, forming about 80%. A blood clot can travel to the brain vessels originating in the heart, neck arteries or elsewhere. This is called an embolic stroke. Let's talk about atrial fibrillation. When the blood is not being pumped out of the heart efficiently, as in atrial fibrillation, may result in pooling of blood forming a clot. Such clots may dislodge, travel to the brain vessels through the neck arteries and cause a stroke. These clots are referred to as emboli. To prevent clot formation, you are put on lifetime blood thinners when you have an irregular heart rate or movement for that reason. Let's talk about hemorrhagic strokes. A hemorrhagic stroke is when blood from an artery begins bleeding into the brain. This happens when a weakened blood vessel, as in a berry aneurysm in the brain vessels, bleeds into the surrounding brain. Pressure from the leaked blood damages brain cells, and as a result, the damaged area is unable to function properly. High blood pressure is the commonest cause. Brain blood vessels may be weak from birth. There could be small aneurysms called berry aneurysms that could burst and cause a stroke. Hemorrhagic strokes are dangerous and are a medical emergency. According to the National Stroke Association, only 15% of all strokes are hemorrhagic, but they are responsible for about 40% of all stroke deaths. Now let us discuss the symptoms of a stroke. Symptoms of a hemorrhagic stroke can vary, but common signs include sudden severe headache, vision changes, loss of balance or coordination, becoming unable to move, numbness in the arms or legs, seizures, loss of speech or difficulty understanding speech, confusion or loss of alertness, nausea and vomiting, loss of consciousness. Please take note that stroke is a very serious disability and take all the precautionary steps to avoid. Hope this video was useful. So cheerio until we meet again. Bye.